sometimes cat and dog, sometimes it just drizzles. Well, still thank God for that day. But today, I don't want to talk about the rains. We already know that we're in the period of the rains already. So you ought to do the needful, wear the appropriate apparels for this season, for this period. Let's talk health. I don't want to say what happened today, but just take very good care of yourself out there. So this time around, this particular time is for us to discuss health. So this is me saying good morning, Akwa Ibom. Good morning, Nigeria. Good morning, world. Welcome to HealthWays right here on Planet Radio 101.1 FM. Oh, yeah. My name is Ofonono Joseph. So you buckle up. Let us discuss health. Enough of the rains, enough of the flood. So right here in the studio, we are going to be, I know that a lot of persons are saying, I don't know, let's just talk about, no, we've talked about the flood, we've talked about the rain a whole lot. How about we talk about something else that pertains to our health, because our health is our number one priority, okay? So let us discuss Hantavirus and COVID-19. Yes. Have you heard the word before? Well, I heard the word some month ago for the very first time. We're going to be talking about staying safe from COVID-19 and Hantavirus. And someone out there could be saying, which one can be Hantavirus again? Do not worry. We have an expert in the live studio that will be telling us what Hantavirus is. We already heard coronavirus, COVID-19, and we are hearing about the resurgence. Again, you know what we went through. You know what we went through, except for babies, that are just giving birth to maybe less than a year plus ago. So I have Dr. Emmanuel Akpanjon in the live studio. He is a registrar, Department of Community Medicine, and a public health analyst, UUTH, that's University of Uyo Teaching Hospital. He's also the president, Association of Resident Doctors, Akwa Ibom State. Good morning, doctor.
Yeah, good morning, Afon. It's a pleasure here with you.
Thank you so much. I don't want to ask you the last time you visited us, but let's just keep it right there.
Been a while.
Yeah, I know. So now that you're here, you're not going to give us that long gap anymore. Sometimes you just have to hop in to educate the public because you're a professional in your field sometimes. So don't just leave us for that long, doctor, please.
It's fine.
All right,
Do our
doctor.
best.
Yeah. Okay. I know you're a very, very busy person, and the fact that you took out time in your very busy schedule to come have this conversation with us, I want to say we really, really appreciate your presence.
Thank you very much.
So, doctor, we're talking about where Nigerians are grappling with insecurity. We're talking about inflation. We're talking about unemployment. There's a whole lot that people are going through, hardship, biting economy. And now the rains are here. And people's property, that took them years to build will just be swept off within a twinkle of an eye because of, the heavy downpour, which at some point I could say it's maybe out of human control at some point. And now, doctor, which one again is Hantavirus? Because we're going through a lot. We're struggling with a lot. Which one is Hantavirus again? We heard of COVID-19 some time ago. So now at the emergence of COVID-19 again and Hantavirus, doctor, please, what is Hantavirus?
All right. Thank you, Mofon. Once again, I'm happy to be here. Hantavirus, COVID-19. I want to say it's good to talk about these two diseases. Your choice of this topic for this discussion is quite apt, and it's a pleasure to bring up to speed the public the emergence of this very disease. We are talking about public health threats and how we are able to put up machineries to prevent, detect, and respond to these public health threats. The Hantavirus disease is not new to the world. It's a disease caused by the virus called Hanta. And so Hantavirus was first seen to have infected persons as far back 1950 during the Korean War, where we had about 3,000 soldiers developing symptoms. And over the years, we've had different outbreaks of this disease. And so the Hantavirus disease is caused by the Hantavirus, and it's an infectious and zoonotic and communicable disease which infects human cells and causes illnesses.
Thank you so much, Doctor. You said we're just not getting to hear about Hantavirus. Well, I got to hear about it, like I said earlier, some months ago. But the World Health Organization had said that it's not a world pandemic. It's not something that we should be perturbed about. And at some point, we started hearing that it left this country to this country. And is that something that we should be bothered about? When it gets to Nigeria, Nigerians will say, I beg, we are strong. Is that something that we Nigerians should be, perturbed about?
It's something to be bothered about because, like I said earlier, it's a public health threat. And between 1950, when we first had a first outbreak of Hantavirus, we've had over 5 different outbreaks. The most recent outbreak of Hantavirus was on a cruise ship on the South Atlantic, where we had over 150 persons on board that ship. And that ship, as the name implies, a cruise ship, persons went for holidays, and they are meant to journey for days and weeks. And so in April this year, persons on the ship began to develop symptoms of illnesses. And then when tested, it was found to be the Hantavirus disease. And so from the ship, the World Health Organization was alerted, and then certain preventive precautionary measures were put in place to contain the outbreak. So it was good that the outbreak, developed within a cluster, a closed cluster, within on the cruise ship, and so it was easy to control. And so we had 13 cases of confirmed cases on that ship, and 3 deaths. And so doing that calculation, the case fatality ratio was 23%. And so it is highly an infectious disease with a high fatality rate. And so it's a concern because every disease in the world today is only one flight away. And so if we have an outbreak in Germany, in the US, in London, in Congo, in South Africa, it's just a matter of one flight before that disease gets to spread. And so the earlier the measures are put in place to contain it, the better. So it's a concern, and it's something that we also need to put an eyes on.
All right. Let's talk about what actually causes this Hantavirus.
Okay.
Why? What causes it?
The Hantavirus, it has been linked to rodents. If you listen to my earlier definition, it's a zoonotic disease, and so it has its origin from rodents. And so when these rodents get to infect human food items, surfaces, clothing, and passing through their saliva, feces, or excreta, they get to be transmitted to humans. And then when it gets to humans, the humans begin to infect the fellow humans. And so we have animal to human, and then human to human transmissions. And so that is how the origin of the hantavirus.
Doctor, you know that talking about rodents,
fellow humans,
you know that
so we have
parts
animal
of,
to human and then human to human transmissions. And so that is how the origin of the hantavirus.
And
Doctor, you
I don't know
that
if I
talking about
could say it's
rodents, you know that
natural.
some parts of
They just value the fact that bush meat is even better than beef, is better than goat's meat, is better than all of. How do we identify which species of rodents or something that carries hantavirus?
Well, we can't really say out of the family of rodents, but these animals find their way from the forest, from the bushes, into where we live and work and stay. And so the group of rodents like rats, like wild mice, rabbits, and the rest, the infectious animals. And so they find their way into the human space. And so it's all about having to control the exposure of humans to these rodents, as a precautionary measure to ensure that they don't, carry these viruses from where they are to infect human beings. And so human beings, yes, they've had this age-long practice of consuming animals from the wildlife, and so government also has a role to play to control the harvest or the hunting of these animals, and the marketing and how these meats are being produced, are being processed. And so there's a lot we need to do, to educate persons about consumptions of this bushmeat, because majority of them are highly infectious.
Doctor, you've talked about, if you're just tuning in right now, you're listening to HealthWays on Planet Radio 101.1 FM, and we're discussing staying safe from hantavirus and COVID-19. You need to really listen to this because it's very educative and important. Doctor, you've talked about animal to human transmission and human to human transmission. How do we identify somebody that has contacted hantavirus? What are those maybe signs or symptoms of somebody that has these viral disease, so that another could, decipher and say, when you do this or when you behave like this, we know that maybe you have hantavirus?
All right, so thank you very much. The hantavirus infection comes with the two spectrum of diseases that emanates, from the hantavirus infection, and these spectrum are tied to different parts of the continent. So a hantavirus infection in the Americas would always present with what we call the hantavirus cardiopulmonary syndrome. That is, it affects the heart and affects the lungs. And so the symptoms would span through these two major systems of the body. And so the person would present with fever, headaches, body pains, and then shortness of breath. And then the person would also have pulmonary edema, and then and other features, that are linked to the gastrointestinal system, like anorexia, nausea, and even diarrhea. And so in this other part of the continent, in Europe and Asia, the hantavirus disease causes hemorrhagic and hemorrhagic fever and renal syndromes. And so these very individuals in Europe and Asia would present also with fever, headaches, fatigue, body pains, and then the classical feature that is linked to hemorrhagic fever, bleeding from the orifices of the body, the nose, the eyes, or the mouth, and even from the skin, and also issues with their kidneys, and so they will pass urine more often, than normal. So These are the classic spectrum of this disease according to the continents. We don't have the definition for Africa because we've not had, these very outbreaks.
It should stay far away from us, doctor.
Yeah, as I said earlier, every disease in the world today is just one flight away, and so we just have to be prepared.
Sad. Well, when it comes to Nigeria, I know what my country people would do. Well, doctor, before we move on, you know that when persons experience the signs and symptoms, a lot of persons, even when they're asked to go to the hospital, if you're experiencing, if you're feeling a certain way and you're seeing things you initially was not seeing, go for a test. But there's this knowledge that some persons have self-medicating. They will even tell you what is happening to them. That is malaria, it could be fever, it could be typhoid, and they will just go over the counter medication, take it, and from there it could spread. What do you have to say to persons that when they feel a certain way, they will self-medicate?
Oh, it's unfortunate that the first port of call for persons who get ill in this part of the world is self-medication. And so the major diagnosis they give to themselves is malaria, typhoid. And so they walk up to the chemist who gives them, or the drugstore who gives them a few medications, and then after a while they don't get better, but they want to try herbal medicines and also venture into prayer houses and spiritual stuff. And so by the time they are presenting to the hospital, they are presenting in a very deteriorated state. And so we always advocate for early presentation, early diagnosis and treatment. And so not all fever are linked to malaria. And so if everyone gets sick and down with fever, malaria, and the rest, the best thing to do is to present to the health facility, get tested, and we have the right diagnosis before the commencement of treatment.
All right. Please, I am just going to open up the phone lines just in time because we always have loads and loads of calls and concerns. Just few minutes to the closing hour. So I'm reeling out the phone numbers. We are discussing staying away, staying safe, all right, from Hantavirus and COVID-19. Before I come back to Dr. Emmanuel to delve more on COVID-19, I am reeling out the phone numbers. The phone numbers for you to call in to ask questions, to lend your view, or if you need clarity, are 0806 804 5443. I'll call the number again, 0806 804 5443 or 0902 223 1011 0902 223 1011. This last number also doubles as our WhatsApp number. Before we proceed, let's talk to this caller. Hello, good morning. Good morning.
I want to, this Hantavirus, how did they manage to know that the name is Hantavirus?
Kindly tell us your name and location, please.
I'm happy.
You're happy?
Yeah.
Where are you calling us from, Happy?
What is it?
Where are you calling us from? Your location?
Yeah, I'm from calling country.
Okay, Happy from Itu. Thank you so much for that question. Doctor is going to address it.
I want to know how they managed to know the name, that the name is Hantavirus.
All right.
Yeah.
All right. Many thanks. Doctor.
Okay.
Just listening. Thank you. All right, doctor. Somebody wants to know, a disease, a viral disease springs up. How do you coin the name? I guess that's what the person is saying. But doctor, before you answer the question, let's talk to this caller again. Hello.
Hello.
Welcome to HealthWays.
Hello, good morning.
Good morning.
Yeah, this is from Calabar.
Promise from Calabar. Talk to us.
Yes. So, how can we protect ourselves from this virus?
How can we protect ourselves?
Yes.
Thank you. Thank you. Just listening. Doctor will address that as well.
Okay.
All right. Thank you so much for calling us all the way from Calabar. Doctor?
All right. Yeah, so for the first caller who asked how the name came about, as I said earlier, Hantavirus is a group of viruses. And so it's asking how come it was named after its name Hantavirus. The Hantavirus is named after the Hantan River. And then, as I said earlier, it's linked to the Korean War in 1950, where we had about 3,000 soldiers develop illnesses like fever, and hemorrhage, and also cardiovascular and disorders. And so the Hantavirus is named after the Hantan River. There's a river called Hantan. Yeah, so that's where the name originates from, in Korea.
I don't know why the person is so interested with the etymology.
Well, he can't be interested because COVID-19 is named after a coronavirus, and the coronavirus is is named after the shape. We call it shape, a crown-shaped virus. So these viruses are named either after the persons who originated it, or the location where it was first discovered. Like Lassa fever, it's named after Lassa, a town up there in the north. So that's it.
All right. Doctor, someone else asked how we could protect ourselves against this virus. Well, that's the topic that we're handling, staying safe. Doctor, before we go to that, we heard about coronavirus, COVID-19. I think it started late 2019 into 2020.
Yeah, you're right.
Why are we hearing it again? And now it's killing people all over. I thought he's dead. Why the re-emergence of COVID-19, doctor? Is that something we did and it came and we started doing that thing again and now it's back? Why is it coming again?
Well, like I said earlier, these diseases, outbreaks, are emerging and re-emerging public health threats. COVID-19, yes, we had the pandemic in the later part of 2019 to 2020, and it was declared a pandemic by the WHO on the 11th of March 2020, because it had gone across different nations of the world. Certain measures were put in place, lockdown, social disruptions, and all that isolation. People died. And then in the course of that pandemic, we had the COVID-19 vaccinations that were rolled out across the world, and even here in Nigeria, we had the vaccination. And so countries have been able to vaccinate the population up to a particular limit, a particular extent where there's herd immunity. Herd immunity is when a lot of persons develop immunity to a particular disease, such that it doesn't cause any further infection, doesn't cause major outbreaks. But one thing with the COVID-19 is that we've always had variants. So one could have developed immunity to variant A, and then we have variant B, variant C, and variant D. So we are having some of these variants in different parts of the country, and let's not look too far away from where we are. Just a couple of months ago, we had an outbreak of COVID. Not an outbreak, we had a case of COVID in Cross River State. And so he was a Chinese man who came into the Akamkpa region of Cross River State, where he works in a cement factory, and developed illness, and having been kept in a private hospital and treated for days, he didn't get better. And when he was tested, it was, said to be a case of COVID-19. Of course, the public health response system was activated in Cross River and even here in Akwa Ibom. And so the COVID-19 is still here with us. There's ongoing community transmission, but of course, not a major outbreak, but we just have to set systems in place, to prevent major outbreaks by observing two basic precautions.
Doctor, I watched a video. I think these persons were made this video. The Americans. They were talking about the fact that some highly placed persons in the world will just stay and think of what to do and feel that we have human beings populating the world a whole lot. And they will, within themselves, they'll ask, what should we do? Especially persons in the medical field and scientists, they'll ask, what should we do? So they would just come up with a certain disease to say it's viral, it's going to kill, it's going to do this, and they will give out a solution to be in a certain medication. So when they inject people with this medication or they take these tablets, people tend to die, and they will say, oh yeah, this is what killed, let's use Hantavirus for example. Hantavirus, 20 persons died in this local government, in this state, in this country. That is not that, there's no virus actually. Some persons just want to reduce the population of human beings in the world.
Well, sorry to say.
Is this a myth, doctor?
It's a myth. The depopulation theories, that comes with outbreaks of diseases is not true. This myth was tied to immunization work in Africa. They said polio vaccines and other vaccines we give to children in Africa were to make them infertile. To also make them dead. Some make them infertile and all that. But what do we have? We have children who were immunized. I was born in the 80s. Immunized, got my immunization. Today, we are all reproducing. We are all alive. We are not dead. And so that myth is not true, and it's not in existence. Just like the fertilizers. When the white men brought fertilizers to Africa, they said they brought them to destroy our farms. And so people rejected them. But today, agriculture in Africa is majorly dependent on fertilizer support. And so the depopulation theory about diseases or disease outbreaks across the world affecting, killing people in Africa is completely untrue.
Untrue. Doctor is demystifying what some persons are saying. That, well, talking about that, doctor, I took was it AstraZeneca for COVID-19?
Yes.
Yeah, I took that before I went for youth service in 2022. I was scared at first because, doctor, nobody wants to die, right? I was so scared, but I wanted to stay safe. I wanted to protect myself and my loved ones, and I just took it. And glory be to God, I'm still alive. I haven't died yet, but some persons are just like that. They say, I'm going to drink, I don't know how to call it, a strong alcoholic drink. If you put it in your mouth, swallow it, drink salt, bath salt, do these. Some do not even believe in this outbreak of diseases at all. Doctor, you know what I am saying. They don't, if you talk about it like, I beg, carry down. There's nothing like COVID-19. There's nothing. Which one is Hantavirus? I beg, shift. And persons like this, when they're infected, they're like, I beg, I know what's wrong with me, malaria. Doctor, what should we do? Because human beings like this they're there in churches, they're there in the mosque, they're there in our corporate environment, in our, street houses. If they are infected, they're definitely going to spread. What should we do with people like this? What do you want to tell them?
Well, thank you, Alphon. What should we do?
Because there's nothing you tell them, they're not going to believe you.
It's what we are doing now. We need to keep on sensitizing the public via health education shows like this. We need to upscale health education talks in seminars, in our churches, in schools. In fact, I go to some private schools, or some schools, I see little children, little kids being taught. I'll go into prevention of this outbreak, but when I see children being taught how to wash their hands, it begins from there.
Yeah.
It begins from there. And so we must begin to consciously educate people, not just educate, get to offer health promotion activities like practicalizing hand washing, respiratory hygiene, and all that. So we mustn't just fold our hands. It's something that needs to be discussed. It's something that we need to talk about. We need to convince people that their health is dependent on how they present, how they maintain, stay healthy by maintaining precautionary measures, how they present to the hospital, how they keep to their vaccination schedule for children, how women should give birth in hospitals under skilled birth attendants. And all. So there's a lot of information that needs to go into the communities because there are a lot of misinformation, disinformation out there. And so if we are able to push messages like this often, then we can upscale the level of knowledge out there, and then persons can turn a new leaf in living healthy.
Great. Dr. Emmanuel Ekem is the Registrar, Department of Community Medicine. Dr. Emmanuel Akpanjan, I'm sorry, there's a Dr. Emmanuel Ekem in my head.
That's my boss, the Commissioner for Health.
Thank you. Dr. Emmanuel Akpanjan is the Registrar, Department of Community Medicine and Public Health, University of Oyo Teaching Hospital. He also doubles as the President, Association of Resident Doctors. Akwa Ibom said, I don't know, doctor, sometime I should come for a free medical checkup. I don't have to pay.
That's fine.
Doctor, you're on air.
That's fine, because yes, check up. People being able to check up themselves is also something that we don't do yet.
Doctor, I said free.
Yes, it can be free, but it depends on who is offering the services.
Doctor,
because some organizations come, like a year of Akisan doing some free medical outreach somewhere, in the state. Also, other organizations do this free, but you are up to the level where you should consciously, get monies out of your pocket to, check up, your health status.
Our listeners are listening to Dr. Emmanuel, so they will hold you responsible if I come and you ask for money. Well, doctor, this thing is really disturbing. You've touched the area of personal hygiene. I want to before I continue, doctor, the phone numbers for you to join in this conversation are still 0806 804 5443, 0806 804 5443, or 0902 223 1011. What are we even discussing? We are talking about something very important that your ears should be all up to assimilate what we're talking about. And I'm talking about staying safe from Hantavirus and COVID-19, because especially that COVID-19 is at the corner. So we need to stay alert. We need to stay informed. We need to be educated so as to know the next step to take. We're in the period of the rains, doctor, and we're seeing some of our areas flood. We deliberately at some point dump our refuse in the gutters. And now that, some areas are flooding, we're saying the government. People's houses are flooding. They will still live in the house. How can you relate the fact that we're in this season talking about personal hygiene and, where these rodents will defecate, where they live, how I want you to bring it back home and marry these two together, doctor, as it concerns the conversation we're having, before we delve into the prevention of hantavirus and COVID-19, so that people will really not waive personal hygiene and always blame the government. I know the government have their role to play.
Well, thank you very much. It's unfortunate coming to the studio this morning. We could see areas flooded by the rains of the night that rained till this morning, and so it's a circle. environmental sanitation on one part and health on the other part. People still dump refuges in gutters, waterways, and when these channels are blocked, water can't find its level, and so the roads are flooded, their homes are flooded. It's a very, very unfortunate situation because the flooded water would end up in places they are not meant to be. They could end up into sewage tanks and then move sewage from where a confined space into the open streets. Then it begins to contaminate, the groundwater. People get out there to drink water from their boreholes and all that, not knowing that the underground water has been contaminated. And so we can see the impact of poor environmental sanitation to flooding, and then the contamination of underground water, and then persons begin to come down with various illnesses, especially cholera. Let's not forget that in some parts of Nigeria, Africa, we still have open defecation, and so this, continues to worsen, the health index that we want to improve. And so persons must begin to, come to tell themselves the truth, that they must own the environment by ensuring that they don't dump refugees into waterways, and then they must take it upon themselves to desilt the water channels, drainage, where they live, stay or work, to ensure that water finds its level, and so we can, stay above the issue of flooding.
Someone called in all the way from Calabar, Cross River State, and the person was asking all of these ones that you people are talking about. I want to know, what should I do to stay safe? And I want to say that's a very important question before I let Doctor go, because he's a very busy person. Doctor, please, what should we do to stay safe?
Yes, thank you very much. What we need to do to stay safe, like some saying, it begins with us. And so we're already doing something now, health education. We're passing this message across to the persons in their homes. That is one. Two is respiratory hygiene. The COVID-19 is an acute respiratory infection. Hantavirus also has a way of getting into the body through our respiratory tract. And so respiratory hygiene, people sneeze, people cough in the open. You see.
Doctor, you might want to pause on your thoughts. Let's talk to this caller. Hello, talk to us. Hello? Hello, we've taken your call. Talk to us. Hello, are you there? All right, how about you call us back, or you send us a text message? Network could be playing funny with us, so I'll call the phone numbers again. Please kindly call us on 0806 804 5443, 0806 804 5443, or 0902 223 1011. If you're trying to reach out to us and you cannot, kindly send us a traditional text message. Send us a text message and we're going to read it out. The last number is 0902 223 1011 also doubles as our WhatsApp number. So you can reach out to us via WhatsApp, or you send a traditional text message, please. And I'm going to read out your message, then Dr. Emmanuel will attend to you accordingly. Please, doctor, continue.
All right, so we're talking about respiratory hygiene. People sit in the open, in the keke, in the bus, in rooms, in populated places, and they sneeze and cough openly. It's wrong. We must begin to teach persons how to cough or sneeze in the open, because when you cough or sneeze, you release the droplets into the open, and then it settles into surfaces, and some persons can even inhale them directly, causing the transmission of whatever infection that person had. So the person, it's advised you cough into your shoulders, your bent shoulders, you cough or sneeze into it. And then that is in the case of where you don't have a handkerchief or the tissue paper. If you have those two, it's best you make use of them, and then you dispose the tissue paper in a closed dustbin. But in the absence of both, it's advised to cough or sneeze into your food, your bent elbow. Yeah. So the other one is hand hygiene. Clean hands really matters. As I said earlier, we must continue to advocate hand washing, the principles of hand washing. Persons should learn how to keep their hands safe by washing with soap and water for at least 20 seconds. During the COVID-19 era, we had so many hand washing stations in public facilities and private homes, but somehow they've all disappeared. We need to continue to have
some still have, doctor. We have.
Okay, that's fine. That's fine. Excellent. So persons we should continue to advise that persons continue to wash their hands or running water with soap.
Necessary.
Yeah. So in the absence of that, we also advise that they can make use of hand sanitizers, to keep their hands clean. It's also known that one of the easiest way of the self-contamination is touching the face with the hands. You'll be surprised that in every hour, the human being is awake touches the face more than 23 times. An average person is awake touches the face more than. Okay.
Doctor.
Good morning.
Yeah, morning.
Good morning.
Yeah, morning. I'm David. I'm calling from you.
Talk to us.
Yes. In the health education, I want to ask the doctor if he knows that the medical sciences originated from homeopathic sciences, then from our forefathers' years, that we have lived to heal all those things called COVID-19. That because of the medical sciences, we don't want to go back to homeopathic sciences. He is aware of this.
So
hello?
Yeah, we're with you. So what's your concern? What's your question?
Yes, because it's not all about medical.
Yeah.
Medical sciences is like a borrowed laboratory. Then we have the homeopathic sciences that we inherit from God and from our then forefathers.
Okay.
That is my take. So at least let us, if he is educating us, let him educate us both medical sciences and homeopathic sciences.
Thank you so much.
So that in absence of the medical sciences, one can easily get into homeopathic and have a remedy to the symptom.
Many thanks, David, for reaching out to us. Doctor,
Thank you.
Yeah, bless your heart. Doctor, I wanted you to land on talking about the prevention of hantavirus and COVID-19 before I ask a question. So I think what this person is asking now is related to the question I wanted to ask. Okay. So let me just put it well. What natural way can we prevent COVID-19 and hantavirus, aside, medically that you mentioned? I know that personal hygiene is a natural way, but doctor, continue with the preventive measures.
I was talking about hand, the use of the hand in touching our face and all that. So the average human being who is awake touches his face at least 23 times every hour. And so if the person is awake for 16 hours a day, you can imagine over 300 times, with touching on the face. And so we ask persons to minimize touching on the face, and so it can be very difficult because is done mostly unconsciously, and so that's why we keep pushing for hand hygiene and hand washing. And so the other prevention is since most of these infections, as we said, come from rodents, we need to find a way to preserve our food. You go to places, they keep food items open in the name of drying them under the sun and all that. Rodents come around, walk on them, defecate, pour their saliva, and pass urine on them, and then they get infected. And so we must find a way to keep our food in safe places, and then stay away from rodents. There are rodenticides and then other practical means of chasing rodents away from where humans live and stay. The other part is use of face masks in crowded places, and when you are ill, there's no need, going into crowded places. And then for an outbreak, just like we used to have those days, social distancing, 6 feet, between every person was being adopted. Then most importantly, early diagnosis and treatment. If you're sick, you have fever, you have body pain, you have bleeding from any orifices of your body, please, the first port of call should be a health center a health facility where you can get tested, and then the appropriate diagnosis is made before the commencement of treatment. For the caller who was talking about homeopathic medicine, yes, homeopathic medicine has been there, right from the centuries and millenniums, ago. And what I'm a medical doctor, and so medicine is what I have competent knowledge about. We've always had debates about this. Most of the question marks we have with homeopathic medicine is the dosing of the formulations. As we speak, the Federal Ministry of Health, I think they now have a department under the Federal Ministry that is trying to bring up recognized traditional medicine, traditional and homeopathy, because it would fall under traditional medicine. And so we want to see how we can, they want to see how they can begin to standardize most of these products, dosing, to ensure that the human beings taking them, take them within the safe limits, and then within the safe limits in view of having the outcome, for which they are being taken.
All right. Thank you so much, Doctor. At this point in time, I would want to leave you to go. We've almost exhausted everything. We are having a discussion on staying safe from Hantavirus and COVID-19, and I have Dr. Emmanuel Akpan John, who's a registrar, Department of Community Medicine and Public Health, UUT head. He's also the president, Association of Resident Doctors, Akwa Ibom State. At this point in time, I want to appreciate you, Doctor, for coming. Thank you.
Thank you, Mofon. It's a pleasure being here, and you're doing a great job, and I encourage you to keep it up. We need to, as I said earlier, reach out more, to people via this medium, because health education is the first step to passing the right knowledge about the health of persons to the public, and then we hope that they can practice what is being taught on this program.
Thank you, Doctor. Thank you so much. Doctor, in essence, you're saying that you're not going to leave us for that long anymore. So.
Well, the difficulties, but we'll try to overcome them all.
Thank you. I'm glad to hear that. Thank you, Doctor. And a big thank you to you on the other side of the divide. Thank you so much for listening to HealthWays. I believe that you have learned a lot. I am so sorry. We're not going to be taking calls, no messages, because we're wrapping up this program right away. I know that you have learned. Doctor has talked about the etymology of hantavirus, what causes hantavirus, the signs and symptoms of hantavirus and COVID-19. He's also talked about the prevention of hantavirus and COVID-19. And at this point, I want to say that you have assimilated something. My name is Ofonomo Joseph. HealthWays comes your way every Thursday, 10 a.m. to 11 a.m. and a repeat broadcast on Sundays, 1 o'clock to 2 o'clock. For now, I will say stay safe and thank you for tuning in.